Hello, my name is Dr. Vasan, the founder of Adroit Surgical. Intubation is the process of passing a breathing or endotracheal tube through the mouth between the vocal cords and into the windpipe or trachea to ventilate the patient. This is usually performed with a standard anesthesiologist laryngoscope, a common device used by physicians during surgical procedures, by emergency medical services in the community, and even medics on the battlefield to secure a patient's airway. Intubation using the traditional laryngoscope is performed by placing the scope into the mouth and directing the tip of the curved blade in front of the epiglottis to push the tongue forward. This movement is upwards and forwards. The user can then usually view the vocal cords and pass the endotracheal tube through the vocal cords into the trachea. The scope is then removed. This technique works the majority of the time. However, disadvantages of this laryngoscope design, including the light source being placed towards the tip of the blade, which can be easily obstructed by blood, vomit, and other secretions. The fact that the blade is curved and open does not allow the user to have a straight line of sight view of the vocal cords. The blade is also open and cannot stop blood or soft tissue such as the tongue getting into the user's way and making visualization of the vocal cords more difficult. Lastly, the user attempts to use the endotracheal tube to intubate immediately with this blade. This is a large, unwieldy plastic tube that can be difficult to insert in any case. Because of these deficiencies using the traditional laryngoscope, I created a patented new self-contained disposable intubating laryngoscope based on equipment otolaryngologists or ENTs already use. We commonly use a rigid metal direct laryngoscope connected to a halogen light source via fiber optic cable to examine the throat for tumors and other lesions. But this scope almost always gives us an excellent view via a straight line of sight of the vocal cords with minimal effort. The key to using the scope is to use a Seldinger technique, using a bougie or tracheal introducer from the outset and passing an endotracheal tube over it into the trachea. Since the scope is narrower and completely closed, the vocal cords are easily seen, but the endotracheal tube cannot be passed through the tube because it is narrow. If the tube were to be wider, then access to the vocal cords would be more difficult. This patented self-contained battery-powered disposable scope takes advantage of a closed circular tube with a beveled end to visualize the vocal cords. Unlike other scopes, the light is transmitted from the proximal end to the distal tip using a ring of LEDs. The light passes through the side wall of the tube as well as within the lumen of the tube to give the user maximal illumination of the target tissue, with minimal chance of light obstruction by blood or tissue. Even new video laryngoscopes have the same disadvantages as the traditional scopes, as the design is similar, not to mention that they are also very expensive and cumbersome to use and are generally not used outside of the hospital. This scope is ideal for trauma situations, both civilian such as after motor vehicle accidents and by the military for blast injury victims, for example. In these scenarios, a simple device that allows an excellent view of the vocal cords with maximal illumination via a straight line of sight has a lower chance of obstruction, and this open view of the vocal cords can save lives. The technique for intubation using this device is simple. With the use of our bougie or tracheal introducer, with clearly visible colored distance markers, it becomes more efficient. A regular bougie can also be used. To begin, insert the scope and identify the glottis opening between the vocal cords. Next, pass the bougie under direct vision between the vocal cords and into the trachea. The scope is then removed, leaving the bougie in place. The colored markings on the bougie help the user keep the bougie in the correct position. The endotracheal tube is then passed over the bougie into the trachea and the bougie is then removed. The user can then begin to ventilate the patient. These steps together take seconds and with minimal effort. The shortest distance between 2 points is a straight line, and the scope's design with a narrower waist mid-tube allows the scope to negotiate the patient's anatomy. The scope is passed under the epiglottis, an easily identifiable laryngeal landmark to view the vocal cords. The beveled opening at the end of the tube sits parallel to the vocal cords, and the tip of the scope can be easily passed between the vocal cords if required to help open the airway further, to give the user the best view possible of the vocal cords. Unlike a traditional laryngoscope, The movement to see the vocal cords is in the user's wrist, with a gentle rotation of the scope using the upper teeth or gum as a fulcrum. The teeth are protected by a silicone tooth protector, which is on the scope. Another significant advantage this device has over other intubating laryngoscopes is due to the scope having a circular transparent tube with excellent illumination, which can be used to identify key laryngeal structures to give the user an idea where the vocal cords may be located. As a rigid, enclosed tube, tissue can be displaced by the tube to still give the user a straight line of sight view of the vocal cords. So if the epiglottis is seen, the user passes the scope beneath it, or if the arytenoid cartilage is seen, then the user passes the scope towards the midline, for example. In trauma situations, the ability to see the vocal cords with surrounding blood and tissue trauma with a regular scope is poor. With this device, the user has the ability to even intubate the patient awake in trauma situations, using air bubbles as a target to help identify the vocal cords. In the United States, approximately 24-25 million people require intubation for general anesthesia each year, and about 4 to 5 million people are intubated outside of the hospital setting in emergency situations. Even routine cases may be difficult, with patient obesity and anatomical differences, and anesthetic complications requiring immediate securing of the airway by other techniques. This device gives the user the best chance of intubating patients in any situation, in or outside of a hospital. Studies have shown that basic emergency medical staff intubate and place the tube in the correct position 50% of the time. Learning to intubate is not easy, and when the situation becomes difficult, such as with morbidly obese patients or after trauma, oftentimes very inexperienced people are required or called upon to perform intubation in these most challenging of circumstances, where even experienced providers would have difficulty. Internationally, intubation is becoming more commonly performed also, and some healthcare systems may have less than ideal equipment and training for intubation, especially in complicated situations. The patented Adroit intubating laryngoscope, with its self-contained power source, straight tube design, and maximal illumination of the target tissue, makes intubation easy, fast, accurate, and less complicated than other products, giving everyone, including novice users, the best chance of saving a life. Thank you.